In today's Staying Healthy report, ways to relieve acid reflux. 1 in every 4 Americans suffers with heartburn and sour stomach.
If it's not treated, it can eventually lead to some major medical problems. So Dr. Dianne McCallister, the Chief Medical Officer at Porter Adventist Hospital, has been looking into some of the new treatments available. So thanks for being here, Dr. Dianne. Let's start with what causes acid reflux.
So acid reflux is when the contents of your stomach percolate up into your esophagus or even your mouth. And some of the causes are increased pressure in the abdomen and a valve at the top of the stomach that's not working very well.
And a lot of people turn to drugs like Nexium, Prilosec, Pepcid. These are all familiar from commercials that we watch. How do these products work?
So the way these treatments work is that they reduce the amount of acid in your stomach. So even though you're still having that reflux, it's not acidic, so it's not as irritating.
It sounds kind of uncomfortable and painful. I fortunately don't have to deal with it, but are there long-term effects that we need to be concerned about?
There absolutely are. More than the pain that you get initially, you can get dental problems from the acid on your teeth, sinusitis, laryngitis, exacerbations of asthma or chronic cough, and then most importantly, people can develop precancerous or even cancerous lesions in their esophagus from the chronic irritation of the acid.
Wow, so no wonder people are looking for ways to combat this. When is surgery an option?
So surgery is generally considered when other methods of treatment haven't worked. So initially you try to do weight loss because anyone who's been pregnant has probably had some reflux from the pressure in the abdomen. So losing weight helps decrease that. The use of those medications that we mentioned that reduce the acid. And then you can change your diet. Decreasing alcohol, chocolate, peppermint, and coffee all can improve reflux. And then when you're lying down at night, you reflux more, so not eating before you go to bed.
You mentioned all of my favorite foods and
Yes.
items that I consume, right? Well, there are some new treatments that have just come out in this past month. We mentioned magnets and a tease a little bit earlier. So talk about some of these new treatments and for whom they're best suited.
So the new treatments, one is a really interesting magnetic brace around the wrist that the study did show some improvement in decrease in reflux. So that's one new treatment. The other is a new surgery that helps tighten up that sphincter or valve at the top of your stomach and prevents things from being able to get up there. With this disease, it's very important that you go and see your physician and get a diagnosis. There's a lot of other diseases that have similar symptoms like asthma and most importantly heart attacks. So you want to make sure you have a diagnosis, and you need to be followed over time because of the risk of cancer.
So it may seem like a minor inconvenience to you, but don't try to be the doctor in this situation. Go talk to the pro and get that diagnosis.
Absolutely. It's really important for these patients to get a correct diagnosis so they get the right treatment.
And do the treatments range in price?
Oh, yes. I mean, from changing your diet can be free to the surgeries can be fairly expensive, but if you've had the right workup, a lot of insurance plans will cover them.
All right. Thank you so much. Dr. Dianne McCallister is the Chief Medical Officer at Centura's Porter Adventist Hospital.
Thanks for being here.